Okay, great. Well, I'd like to welcome everybody to Combat to Calm. And I'm introducing Dr. Jon Porman. He's a Marine, a healer. Well, you're simply legendary, right, Dr. P?
Correct.
And you're founder of the Legendary Healing Foundation. You're on a mission to heal, inspire, and empower 1 million lives. I think you can do it in 5 years. You're a U.S. Marine. You're a trauma-informed clinician. Your focus area is to help veterans, first responders, and underserved youth to reclaim their purpose, wellness, and meaning through cutting-edge treatment, spiritual focused retreats, and leadership coaching. You basically heal everybody, though, on your day job. But this nonprofit, this foundation is really focusing to heal those who serve and those who maybe can't afford care. Your approach is rooted in a belief that healing is not just physical, but mental, it's emotional, it's spiritual. And through your clinics, your keynote speaking, and your legendary living retreats, you're delivering real transformation. So without any further ado, let's talk about going from combat to calm.
Thank you. Welcome to the Legendary Healing Foundation webinar. My promise today is to help you understand that your body can stay on high alert and you can rewire that nervous system for peace. There's some simple things. These aren't the only things. It's not exhaustive. Yet what I'll give you are some very quick, easy things to do to help your brain's capacity for change. It's called neuroplasticity, and that is the pathway home, the way to get back home. Only 6% of our population are veterans. Only 6%. Yet we comprise 15% of the suicides in the population. Let me say that again. 6% of the population are veterans, and yet we comprise 15% of suicides in all the population. Female veterans are 2 times higher at risk of committing suicide than the general population of women. And those are things we need to think about. So this isn't about suicide treatment. This is about getting people long before they ever get to that point. This is not just about combat veterans either, because we all can go through stresses. We all can go through PTSD. We can all go through depression and anxiety and all the same things. It's just that us veterans just have at a little bit higher rate and a little bit worse because the situations that we can be put into are accelerate that. So approximately 14 to 16% of all U.S. service members deployed to Afghanistan and Iraq, it's been reported that have been affected by PTSD. That's 14 to 16%. That's a high level. What we need to know is that there's like 4 evolutionary type responses through to stress. One's going to be social engagement, which is kind of the newest thing that we found. That's like connection and safety. It's the fight or flight, where we are mobilized for survival. We're either going to stay and fight or we're going to take off and run. We can freeze or shut down, which is one of the oldest ones that we found, and that's kind of like a last resort protection. But then there's another one, the newer one, and that's the fawn, where we don't just freeze, we actually play dead. So those are just some things to think about. Like that's the areas that we can go when we're under a lot of stress like that. So in combat, even everyday stressful situations, whether it be in combat or outside of combat, whether it be in the military, not in the military, your nervous system has learned to skip sometimes those responses and default just to the survival mode. So we get into what's called like a stuck switch. So when we experience trauma or even perceive trauma, our nervous system can respond in protective mechanisms. So we say that it's abnormal, yet it's not. It's a normal response to an abnormal event. And I'll say that again. Those are just normal responses to the abnormal event. The abnormal event is, watching someone be injured, watching someone be mortally injured, fatally injured, those kind of things. But we don't have to stay stuck. There's things we can do to get out of that stuck mode. But just understand there's things that the brain will change from combat, from trauma, from stressors, whatever term you want to use, depending upon the level that it's at. One of them is the amygdala. it's a little portion of your brain in the center of your brain that is a threat detector, and it becomes hyperactive under people that are under chronic combat, chronic trauma, chronic stress, chronic pain. The prefrontal cortex, which is at the front of the brain, has to do with rational thinking. That one goes offline. So now you're not able to actually think through situations, and you can make some really poor decisions. And then the hippocampus. We know that the hippocampus, which has to do with memory processing, actually will shrink in people that are under PTSD, depression, anxiety, high levels of stress, high level of pain, high level of trauma, those kind of things. So just know this, that if you're a veteran and you're dealing with chronic pain, your body can be, and most likely is, holding on to combat memories. And that pretty much goes for anybody. If you're dealing with chronic pain, a lot of times what I see in my clinic over the last 30 years is that the body's holding on to combat memories. The good news is you can retrain your brain and you can rewire your brain at any age and after any trauma. You know, we previously believed that the brain was fixed after the age of 25, and now we understand that's not true, that there's a thing called neuroplasticity to all these systems of the brain that supports recovery from PTSD and from trauma, and helps us to withstand new neurological insults that we can have, which we're going to have. Just watch the news. That's a neurological trauma almost every day with the things that are being shown on there. The rewiring process, you can improve your memory. And we know that if I can improve your memory, it's a predictive value to reduce your symptoms of PTSD, specifically the intrusive, re-experiencing, or avoidance behaviors that we have with PTSD. So there's like 3 pathways to this healing, and we want to create new neural connections. So it's like if I took a road and I'm going to reroute the old roads to create new intersections. So the road's still there, but I'm going to change it so it's going to intersect at a different angle. So we're just talking about rewiring. We're going to strengthen the positive connections we already have. So we're going to basically take that road and we're going to widen it. So we're going to widen the highways. And then the last one would be we're going to prune or tear up the old roads. So we're going to prune those bad connections and help us create those new intersections. So there is hope because, you know, as recently in the last couple of years, we've shown that hyperbaric oxygen therapy, which is where you go to you go into a chamber that increases the pressure of the oxygen being delivered to your tissue, has shown improvement for these acute insults of trauma, whether it be brain injuries, traumatic brain injuries, whether it be with PTSD, whether it be with different levels of brain function. So 100% of the participants that were in this, that were diagnosed with PTSD 6 months afterwards, showed that after their therapy of the vagus nerve stimulation, they all saw improvements in their PTSD. So your combat/life experience, you know, can carve deep neural pathways or trenches, but these connections can be built and help you ease your suffering so that it's not a trench anymore, but it's actually a groove. And that's just my term. So I'll give you an example. There's a firefighter that had trauma. He not only had physical issues, he didn't know he had the emotional issues, and I helped him work through that, some of the stuff, with my TFT, targeted frequency therapy, which is where, you know, I'm either using sound, electrical, or light therapy to change his vagus nerve, and in doing that, got rid of some past issues that he had from other traumas that he had, but they were more psychological, they weren't physical, but then those two tied together, they got rewired together. So what am I talking about? Like when I helped him with that, you know, in a basic level, you know, you say you rewired him, you change some connections, that's great, but what is it that you do? Well, you're trying to take that parasympathetic pathway to peace. And that's really where the rubber hits the road, is you're working with the parasympathetic pathway. Now, some things I'm going to talk about today are not just about the things I'm going to talk about, but there's other things out there that you guys might know about, might be on Instagram, might be out on the web, you know, might be someone else doing a webinar on things that are out there that you can do with the parasympathetic. And that's great. Anything that's going to help is awesome. I'm all for that. So just know the sympathetic's like having your foot on the gas. That's like your combat mode. Your parasympathetic is your rest, digest, heal. That's the peace mode. Now, that's very, very basic terms. That's not exactly 100% the way it works. Yeah, that's the way we're gonna go with it, because it makes it the easiest to understand it that way. So then there's a thing called alpha waves, and we'll get into brain waves here in a second. Alpha waves are, anywhere between 8 and 12 hertz, if you want to know. And it's linked to being like relaxed. It's the healing. It's the mind-body connection. And that's where we're trying to get to for that healing state. So brainwave progression, you got to look at this like gamma. Gamma is the state of gratitude. Gamma is between 30 and 100 hertz. And that's more of where we think about the Tibetan monks. The beta mode or high beta is anywhere between 15 and 40 hertz. And that's where we're active, we're alert, but also we can be stressed. And so that's every day. That's the beta mode. We want to try to drop down into alpha, and we do right before sleep. That's about 8 to 12 hertz. And that's where we're relaxed. Healing takes place during that time. We may reduce depression and anxiety. We may improve creativity, decrease stress or perceived stress. Because remember, stress is all perception. If I have my patients go out, and I tell them this, right? Go out, and when you come back tomorrow, bring back a bucket and give me all the stress that you had the day before. Put it in that bucket, and I'll tell them it's going to come back empty because that's perceived. That's not actual. Perception is where the stress is lived. It's not an actual experience as far as something I can put into a bucket. And then there's theta, and theta is the next level we drop down into before we get to delta. So as we start to go into sleep, we go from alpha down into theta, and then we drop down into delta. And theta is between about 4 and 8 hertz. That's really deep healing. That's trauma processing and helping people get through some of that stuff that they've had. And then the last one is delta, which is about a half a hertz to 4 hertz. So how do we get to this road of peace with the vagus nerve? The vagus nerve is responsible for, visceral sensations, and it helps the body modulate stressors. It's called the vagus nerve because it actually loosely comes from a term called vagabond, because vagabond means like wandering. So they call it the wandering nerve. The vagus nerve can help us with a lot of things. And the number one thing it can help us with, if you're a veteran, would be PTSD, depression, anxiety, or just overall calming of yourself. So you can control this parasympathetic system, and you're going to see that it's not real difficult. I do it every day with targeted frequency therapy, TFT, where I help people shift from a sympathetic to parasympathetic, and I can do that, and I can measure that in real time with certain modalities that I have that I can do that with. So what are some tools we can have today? So I'm going to give you some quick shifts. The number one thing I teach, because it takes less than a minute, it literally can take 10 seconds if you were measuring someone, and that's called a physiological sigh. So people go, what's a physiological sigh? There's other terms it's used. I like the term physiological sigh. Think about it when I'm crying. When I'm crying and I'm trying to stop crying, I'll at the end of that, right? Or your children are crying, they're like, right? And so it's those couple in-breaths like that. That actually is a way to calm us down. You think that it's actually driving your child or you to be more upset, but believe it or not, that actually lowers our heart rate, and it increases our heart rate variability, which has to do with dropping into parasympathetic. So it signals safety to your nervous system that everything's going to be okay. Like I said, it increases heart rate variability, it decreases heart rate, it calms your nervous system, and it increases alpha wave brain waves. So one of the ways we're going to talk about doing that is you take 2 breaths in through your nose, and it's kind of vigorous, right? And then a long, slow exhale. So it's, if you're working out and you want to feel like you're getting too riled up, or you want to get a little bit more oxygen to your tissue, is one of the things to do that, right? Just do 5 of those and then go right back in and do it another set. And you'll find that you can maybe do a little bit more than you would have normally been able to do. If you're in a stressful situation, someone's cut you off, or feel like you're just getting a little bit of a panic attack or an anxiety attack, just do that one time, and you'll see that it starts to lower your sympathetic response, and it increases your parasympathetic, and you'll just get into a more calmer state. Again, it's 2 in breaths through the nose, and exhale as much as you possibly can, trying to exhale all of that air from your lungs. So in through the nose, 2 of those, exhale through the mouth. Another one we could do would be cross brain or cross body, cross lateral movements, where, I'm not going to stand up, but we would stand up and we touch our right hand to our left foot back behind our body, or our right hand to our left knee, and we go back and forth, and we're doing these movements where we're doing what's called a cross crawl pattern. We know that it integrates both hemispheres of the brain, and we might do like 10 per side. That's another thing that can calm us down. Another one that we can do is we can sit right here, put our hands on the desk or table, and then look up to the right, up and back, and hold that. We know that that stimulates the vagus nerve, not to the same degree that the physiological sigh is. By far, that's the best. And then I can look up and to the left, and I hold that for 10 seconds. And we've seen that that does decrease the sympathetic stimulation and increases parasympathetic. But again, the very, very best one to do there would be the physiological sigh. So then people ask me, like, what are some daily practices I could do that might take between 5 and 15 minutes in the morning and in the PM? So in the morning, the first thing I would do is I get out of bed, or before I get out of bed, I would do like maybe a 1-minute scan of my body and see where I maybe have some aches and maybe have some discomfort. I have some things that don't feel so great. So if I want to identify that attention to the tension to that area, put my attention there, I'm going to breathe oxygen in through my nose, but I'm going to imagine it going in through that body part. That's one way to go. Another way that people talk about is you imagine, and this is called HeartMath. So you can get on heartmath.com and buy some things through them, or you can do heartmath.org and you can read all the different articles where they've helped first responders, military, veterans, athletes, where you breathe in through your nose, out through your mouth, but you're imagining that the oxygen is going in and out of your heart, not through your lungs. And then you put a smile on your face, you close your eyes, and you imagine someone that puts a smile on your face, and it will put a smile on your face. If you think about your grandma or your sister or your wife or your dog, that right there would drop you down into a parasympathetic mode. That increases heart rate variability, decreases heart rate, and can drop you into a more parasympathetic mode. Another thing would be, I like cold plunge. So cold plunge, people go, but I don't have a cold plunge. Or maybe you're a college student, you don't have a bathtub. Then all you need to do is get a plate or a dish that you can put your hands into, or you can put your face into. You put your face in there for a total of 2 minutes, but you maybe do it for 20 to 30 seconds at a time, take it back out, put it back into the bowl or the plate, because there's receptors in your forehead, in the palms of your hands, in the bottom of your feet, where you have what's called glabrous skin. And glabrous skin is where, well, I shouldn't say receptors because that's not exactly true. What you're trying to do is stimulate or decrease the temperature of the vascular system. And so in doing that, the arterioles go right into the venous supply that goes right back to the heart, and it actually lowers your temperature. But at the same time, when you put your face in there, because of the receptors in your face, you'll actually wake yourself up. So that's a really good ritual that some people do. Another one would be muscle activation. So if I'm really having a hard time getting going, I really don't want to go work out, I really don't feel like getting up out of bed, just get up out of bed and do a wall sit, do squats, do stairs, do some sprinting down the hallway, literally like 1 or 2 sprints. That wakes up. Anytime you activate these big body parts, it believe it or not, it actually activates the parasympathetic nervous system that actually wakes you up. So everyone thinks that's what I was saying earlier, like that's a very broad generalization that sympathetic always calms you down. Depending, it can, and most of the pathways are that way. Yet there is one major pathway that if I do squats, I do the stairs, just like up and down one time. I do some sprints down the hallway and back. I do a squat for wall sits, I should say, not even squats. I could do air squats, but that's not going to be as activating as if I did a wall sit for 30 seconds to a minute. That activates the part of the vagus nerve that actually wakes up the brain. It makes the brain produce some adrenaline up into the deep centers of the brain. It wakes us up. And then what about an evening ritual that would calm us down or wind us down? You could do something called legs up on the wall pose, where you're activating your parasympathetic system, putting your legs up onto the wall. You wouldn't have to do that for very long. You also would do that while thinking about gratitude to things that have went on that were really awesome in the day. You might even think about the things that are going to come up the next day or things that you want to have happen the next day. I like that. Do a hot shower, whether that be for 3 minutes to 5 minutes. That's actually really good because it can shut off your brain. And if you're having a hard time getting your brain to shut off, I take that back. If I'm doing the heat, that's really relaxing me. But if I'm trying to shut my brain down, I'm going to try to flush out some of those catecholamines in my brain. Then what I want to do is I want to do 5 minutes of hot and then 30 seconds of cold. Again, just 5 minutes of hot, 30 seconds of cold, dry myself off, go into bed. I've done that with patients over the years, and they say they sleep like a baby if they have that. So what I'm trying to target in building these new nerve pathways, for ongoing day-to-day, is I'm trying to target the alpha theta states. Meditation and visualization, but especially meditation, will activate the parasympathetic nervous system because you're shifting from like a high beta into an alpha theta state. If I walk in nature, because of the bilateral movement of the environment going past me, that's basically where EMDR came from. And so EMDR is a technique that therapists use that has a bar that goes back and forth, and your eyes just follow the bar, the light. It's a set of lights that go back and forth, and you follow that, and that has a tendency. And what they found was a researcher, PhD, found that because she was out in nature and she just got into this really, really, really great Zen state. And was it really nature, or was it the movement of her eyes or things passing past her eyes? So that was where she came up with this bar, and that actually works really well too. Another thing would be, if I want to keep my serotonin levels in my brain higher, believe it or not, the way to stimulate that. So I know I said before, 90% of all serotonin is produced in the gut, and that's true. Yet the vagus nerve can be stimulated. So if I keep high levels of serotonin in my gut, so it's very important to keep my gut health, believe it or not, the vagus nerve from the gut goes up to the brain, stimulates the brain now to produce that other 10% that stays in the brain. Because the serotonin in the gut doesn't go to the brain, not directly, it does stimulate the vagus nerve to goes up to the brain and tells the brain to now produce serotonin. So that's why people that are somewhat depressed, can be major depression or even minor depression, a lot of times have gut dysbiosis. What that means is their gut microbiome is off, and the reason that their brain is off is because it's linked to the gut. So if I can get the gut in a better what we call microbiota or better terrain, it has a better stimulation to the brain through the parasympathetic part of through the vagus nerve, which is the parasympathetic, which releases serotonin, and my brain actually functions better. Another thing would be like what I do in my clinic every day, which is targeted frequency therapy. I do targeted frequency therapy every day in my clinic, whether it be through light, electrical, or through sound. And I'm helping people rewire their brain through that. And whether that be through a head injury, or whether that just be through just general trauma of watching TV every day or listening to the news every day, we all are having areas that we need to have some help with in our brain to balance our brain. Like, I'll tell you this, during COVID, there wasn't one patient, not one patient, that I saw for the first time. And for many of them, it was almost every visit, but every visit, for the first visit, I had patients come in where I literally couldn't evaluate them because their brain had hijacked their body. And so where things looked strong, everything was strong. And where things were weak, I literally could push pro football players with a pinky. It was absolutely insane. So then I had to say, what do I need to do? I had to go in and run a program that I call, it's an electrical program that I call concussion, that I would run on my people, my patients, and it would balance them. Then it'd come back, and if everything looked crazy strong, like they looked like their muscles were made out of iron, or I could push them with a pinky, now everything was normal. Some muscles were strong, some muscles were weak. If I did certain reflexes, the reflexes worked right, where before they didn't. And so that was one of the things I saw during COVID because of all the stress. Some people got COVID, some people knew people that passed from COVID, some people just watched news and it stressed them out. And so that was one of the things I did with them. And that's one of the things I do every day with my athletes and with my patients, is I do targeted frequency therapy every day. The thing about PTSD is that people think like, there's nothing you could do about it. And there's so much you can do with that. I think that's one of the reasons that less than 47% of all veterans actually are registered with the VA. Listen to that again. Less than half of all veterans are even registered with the VA. Because I think that then again, this is not a knock on them, the VA. It's just that the tools that they have are not there. They're not helping people to the realm that they need to be helped. They're throwing drugs at the symptoms. And as April can tell you, because she's been an ER nurse for over 30 years, is that medicine is great at this. It's great at emergency medicine. You have a stroke, a heart attack, you getting gunshot, you got stabbed. It's awesome for that. That's absolutely awesome for that. Just like that. If you're stabbed, you have a gunshot, you're having a stroke, you don't come see me. That's not what I'm great at. That's not my forte. You need to come to me when you're looking for health and wellness. So after you get that taken care of, the crisis is averted, you're going to survive. Yeah, don't go back to them for health and wellness, because that's just not what they're designed for. It's not a knock on them. That's not what they're trained for. You come to someone like me. But you also don't come to someone like me when you have a stick in your eye and you have a gunshot and you're uncontrollable vomiting and those kind of things. So we just have to know what we're good at, what we're not good at, and then be able to refer to people that can help with that. It's just like counseling. I love therapists. The problem with some therapists are they want to talk about that same problem over and over and over again. And all you're doing, in my opinion, but I've been doing this for 30 years. So I think I have a valid opinion because I've seen this for 30 years, is that all they're doing is rewiring that old pathway.
Or reinforcing the narrative.
Right. Yeah. So you just reinforce the narrative. That is that, things are tough. Boy, that's tough, versus trying to get something new and refreshed and trying to build a new pathway. So I tell people, like, you're on a go-kart track, or you're on a racetrack, a dirt track especially, and there's two grooves, right? Well, I take that back. There's a groove, and that's at the bottom or the top, could be in the middle, whatever, but it's the one that's going to take you the fastest around the track. And then there's the rut. You hit the rut and it just boom, takes you right off track. And next thing you know, you're off into the stands or you're off into the weeds. And so that's where we want to try to do, is try to find the groove in life, because that's where the sweet spot is. Try to find the groove and stay out of the ruts.
Dr.
So
P,
what are some immediate actions? Did anybody have any questions? Vince, you have a question?
Yeah, Dr. P, you introduced this topic around that increased suicidal ideation rate. And, I think we were talking earlier a few days ago, but, how much sleep impacts, just being tired and making poor decisions because you're tired. Maybe you're trying to kick a habit and you're just tired, and it's really hard to make good decisions. When, like, talk to a veteran in like 30 seconds. Give me a good bedtime routine. Like, order me to turn my screens off at a certain time. Tell me to go through, like, just give us that 30 seconds nighttime routine for a veteran that's in a rut.
Great question, because guess what? I actually left that out, and I never leave that out, because the number one question people say, how do I improve my health? I go, it's the same thing as how do I, cause a detriment to my health? And they go, well, what is that? I go, sleep. If I improve my sleep, I get better sleep. I get good REM and good deep sleep. I'll improve my health one way, I'll improve it to some degree. And if I get poor sleep or not enough sleep, just not good quality sleep, it's broken up, whatever, it'll be a detriment to my health for sure. So you're absolutely 100% on there. So I need to make sure that my environment's completely blacked out. There's lots of research on that people can say my eyes are closed. Well, your eyes can be closed, but believe it or not, the light still gets through your eyelids, that gets to your eyes, and your eyes are the outpouching of your brain. And so, if I want to get my kids to wake up earlier in the morning than they are, is one of the techniques that they've done research on, is that you tell them, you just can't I'm going to turn the lights turned on. You just can't pull the blankets or put the pillow over your face. You can't put anything over your eyes. You can keep your eyes closed. You can stay in bed, whatever. But we know that actually starts to wake us up, believe it or not. You could be the same thing in the middle of the night. That's why night lights are not good. That's why it's not good to, when you get up in the middle of the night, if you have to go to the bathroom or something, to turn all the lights on, because that just floods your brain with more stimulation. So I want everything to be dark. I want it to be as cold as possible, because we know that the best sleeping environment is, believe it or not, is right around 72 and lower. Anything above that is just too high, and we just don't sleep well. People would say, but I'm under all the covers. It doesn't really matter, because it's still hitting your face. And so we know that to go to sleep, we need to drop our internal temperature. That's one of the reasons, like, we could go in a million directions, but one of the things you might want to take before you go to sleep, a couple hours before sleep, is glycine, because glycine will actually drop your internal temperature by about 0.5 degree. And in a couple areas, I could use that. I could use that before a workout. So it allows me to work out harder because I have lower internal temperature. The reason I get to failure with a muscle is not because the muscle doesn't have enough energy. It can be that, but if it's only like 15 or 20 reps, it's actually because the internal temperature of the muscle is so high, the brain's afraid the muscle's going to overheat and it's going to implode. And so it just goes to failure. But if I can lower the temperature, and that would be one of the things with glycine. Same thing in sleep. I can't sleep if I'm going to be hot. People say, oh yeah, if I sleep fine. Well, you might sleep fine what you think is fine until you learn to sleep in a colder environment. And then if it's being measured, sleep is way different. REM's different. Deep sleep is different. The quality of sleep is different. The amount of sleep is different. You wake up more refreshed. So that's a great thing. I wouldn't be drinking coffee past like 2 or 3 in the afternoon. And I wouldn't probably be drinking it even past noon if I was a low methylator. So I just found that out with one of my patients where he's got liver disease. He's super young. He's only 35 years old, but he's got liver disease. And they're telling him it's, you know, they didn't even do a methylation test on him. I did a methylation test on him and found out that he has these things called SNPs, single nucleotide polymorphisms, and SNP. And so he has that. And what it means is he's got a genetic defect in a couple things. COMT, which is one of the things you can check. He's got that. He's got the MRR defect. He's also got another one called the MTHFR gene. And a lot of women know about that because they don't process folic acid very well. So folic acid is not the predominant source of folate that we need, because folic acid has to get turn to methylfolate and a couple other substrates to be able to be absorbed. Folic acid is actually toxic if you have the MTHFR gene. So this guy can't produce what's called methyl groups because he doesn't methylate. Methylation helps us get rid of mycotoxins, which this guy has a lot of mycotoxins. Helps us get rid of infections. The guy has lots of infections. It helps us get rid of just general everyday toxins in the environment, which this guy has. He's got a bunch of chemicals in his GI tract. He's got chemicals in his liver. He's got a bunch of different things, but that's because he's not methylating. So if I did something as simple as glycine before I went to sleep at night, that would help me sleep better because it lowers my temperature. If I find out that I'm not a good methylator, then I wouldn't want to be drinking coffee later in the day. I wouldn't want to be drinking alcohol at all because we know alcohol is bad for the brain anyway. And I see that where no matter what time of day people drink alcohol, if they drink even a glass of alcohol and then go to sleep and they're wearing some type of Whoop or something on them, they see that their deep sleep drops tremendously, their REM sleep drops tremendously, and they just don't recover. And that's not one day. That's usually for 4 to 5 days afterwards. So that would be something I'd stay away from. Alcohol, caffeine, at least caffeine past 2 or 3 o'clock, unless you know you're not a good methylator, then noon. Dark, cold, and then if you could turn off Wi-Fi. If not, turn your phone on to airplane mode. And then the other thing is if you have any kind of pets, don't let the pets be on the bed unless they literally go to sleep in one spot and don't move. That would be all the really good things, because sleep is super imperative, and I'm glad you asked that. And I will add that to the notes, because that sleep is by far the number one thing we need to do. The other thing is I started doing this. This works really well. Do the physiological sigh before you go to sleep. Just do 5 to 10 of them. And that actually, every night I've done that, and I haven't done it. I've gotten good REM sleep, but I'll get even better REM sleep and better heart rate variability if I do 5 physiological sighs, 5 to 10 physiological sighs right before I go to sleep. Because it's dropping you down into a better parasympathetic, which also then will equate to alpha waves. So I'm more relaxed. I'm going to fall asleep faster.
Did we speak about taping the mouth and breathing through the nose only? I've seen some things on
you can
TV.
Do that. Here's the problem with that is it works really well. People that are mouth breathers, you don't do as well. You don't release as much nitric oxide. We know that when you breathe through the nose, you release more nitric oxide. People go, what's nitric oxide good for? It's great for athletes because it's a vasodilator. It's great for your blood vessels in general because it's a vasodilator. If you have erectile dysfunction, it's great for that. If a woman has issues with her vulva, it's really good with that. Nitric oxide is something that we start to lose because it's produced a couple different areas, but the biggest area is the older we get, as you get into your 40s, 50s, and 60s, is what's called the endothelial, or the inside lining of the blood vessels don't produce as much nitric oxide. So it's endothelial lining nitric oxide. If you don't release that, it makes its own, it releases it, and then the blood vessels dilate. And if they don't dilate, you get more constrictures, you get more hypertension, you get more, which is higher blood pressure, not high blood pressure, but higher blood pressure. You don't get as much elasticity in the blood vessels. So something like nitric oxide is great. How do I get that? By breathing through my nose. Too many times though, people learn to breathe through their mouth because they maybe have a deviated septum, or they have one side more open than the other, and they don't breathe very well. So there's some of those nose strips that can work. You can do some inhalers with essential oils that can work. You can put some essential oils at the tip of your nose. That works. But you'd have to figure out, if you put the mouth tape on and then you end up taking off in the middle of the night, you have to figure out why. There's usually something wrong with your nasal passage that you might have to have something looked at there.
Which essential oils? Are you looking at lavender or other?
I would look at, well, there's different, essential oil, another good question. So essential oils can be stimulatory, they could be somewhat neutral, or they can be relaxing. So what we found in the literature is chamomile is like a chamomile tea is very good, relaxing. Lavender is very good at relaxing. Vanilla, believe it or not, there's research that if you put vanilla in your air intake or in your external outtake, that you can relax your patients, that you'll see that their heart rate drops in a doctor's office. You'll see that they're less combative, that they're less finicky about different procedures. Everything just seems to relax. If I did something, any of the mints like spearmint, winter mint, winter green, any of those seem to be more stimulatory. If I do something like cinnamon
and orange, I believe orange is
very stimulatory.
more of a morning one.
Yeah.
Very cool.
Basil, that seems to be more relaxing.
Just to pivot a little bit, for Division I athletes, could you give some insight on, I see Emmett Johnson, who's running back one for University of Nebraska, when they go into the stadium on a game day, before the crowds actually get let into the stadium, because I don't see them doing it. It's like that time when the players get to run around a little bit and throw the ball. You see some players, they're throwing and catching and just jogging around and taking it all in. Emmett Johnson is meditating at the goalpost, and it's his pre-game ritual where he's just kind of getting his alpha, theta, all that. Can you kind of explain why that would be good? I guess it's a long 4-hour game and he's just not trying to get amped up too quick, but what's a good pre-game routine for athletes that would include that type of meditative, schedule?
It doesn't athlete. You're getting ready to go into a board meeting. You're getting ready to go into some type of hearing. You're getting ready to go in to see a patient that's been difficult in the past. You're getting ready to go in to see, you go in to talk to your child, and your child's, been kind of a pain in the rear end the last couple of weeks or whatever, or you're afraid this conversation is not going to go well. Drop yourself down into an alpha state. Why? Because when I'm in that alpha state, I'm using more of my prefrontal cortex. I'm better at reasoning. I'm better at thinking on my feet. I just know that when I'm got that adrenaline state going and I'm more in the beta state, that my thinking goes down. My prefrontal cortex drops. The other thing is this: we know that the visualization works, and the athlete should do that. But also, if I'm going into a board meeting or a tough conversation, is I want to visualize what it is that I want to have transpire in that meeting or in that game. And the body doesn't know what the brain perceives and what the body actually goes through. There's been tons of research with that, where, we've all heard about the basketball one, where, they do one group of the kids that actually shoot baskets. The other group doesn't do anything. The other group just imagines shooting the baskets. Well, now they added a fourth group, and that was people that practice shooting physically and mentally. And they actually outshined all the others, because the ones that didn't do anything didn't improve. The ones that shot baskets improved. The ones that did visualization before, only did visualization, they improved the same amount, statistically the same amount as the ones that actually shot baskets. But the ones that actually improved even more than that were the ones that shot the baskets, but actually visualized at the same time. So then there was one done where they wanted to see, you talk about neuroplasticity, they wanted to see what would happen if you took a group of kids that played the piano. So they had kids play the piano, kids that did nothing. I think it was an hour a day. And then kids that just visualized themselves playing the piano, right? So they just imagine, close their eyes, imagine their fingers going through. They didn't move their fingers. They didn't practice like it was on the piano, but just use their mind. But they saw in their mind's eye, they saw their fingers playing the piano. And they not only saw that they improved as much as the kids that actually played the piano, but they saw in brainwave patterns, brain conduction patterns or nerve pathways, neuroplasticity. They created neuroplasticity just like the kids that actually played the piano. So we're pretty sure that's why it did the same thing in the basketball trial. So he's dropping his cortisol levels, which are stress levels. Which is also adrenaline. He's dropping adrenaline. He's not getting adrenaline dump, because that's where too many guys get too hyped up before the game. They come out and they're all, rah, rah, rah. And then the game starts, and then they start to drop because they've burned off so much adrenaline that now their body's burned up a lot of glucose. Because when I'm in that adrenaline state, I'm burning lots of glucose, lots of sugar. And then it's also mental fatigue. So he's dropping himself down into that alpha state. He's more than likely, because this is what I've done with my athletes all the time, is you visualize the outcome that you want to have happen. For some guys, they have to visualize at the same time, they have to visualize something going wrong, and how are they going to respond to that? So they don't react negatively, but they respond in a positive way. So they visualize something happening to their team. Someone fumbles the ball, someone misses the block, whatever. And then they visualize themselves going to that athlete, talking to that athlete, help them through it. And so they actually are still building the nerve pathways, even though they physically didn't go through it. Their brain thinks they did. And so when that does happen, transpires, they're more likely to respond than react in a negative way. So I don't know exactly what he's doing. I'd like to talk to him about it, but that's more than likely what he's doing, is those two things: dropping himself down into an alpha state, and then also preparing himself to create the outcome that he wants. Because Vince, this is, you're talking about this now with your mastermind group that you're creating. And that is that you have to have the idea of abundance. If it's the whole concept. If I don't believe I can, or if I believe I can or believe I can't, either way, I'm right. That was attributed to Eleanor Roosevelt, whether she said that or not, but it's attributed to her. That's true. Like, if I believe that I can touch 1 million lives, I will, or I'm more likely to, so well, I take that back. It's not the idea of a belief, because I teach this. I just said it wrong. I know that if I have a belief, within the word belief or believe is the word LIE. There's a lie. I need to change it from a belief to a knowing. It's like you and I have faith. We don't have faith because we believe. I don't believe it's a belief. For me, it's a knowing. I know there's a God. I know that I have a higher power that helps me every day. I know that, like my sister passing at 15, I know that my sister passed at 15 because it was to give me the life that I have. It showed me the light. It showed me what can actually be accomplished in this lifetime. Someone asked me that the other day and said, hey, when you get on the webinar, could you share your story a little bit? Because I don't know if everybody knows that. And I'll just share a part of it today. And that is, when I was 15 years old, we were called and said my sister was involved in a car accident. So, it was right around midnight. And so I said to my mom, I didn't have school that next day, and it was on a Friday. I remember this, February 15th, 1980. And said, can I go along? She said, sure, because we're just going to go there and pick her up like we always do. She's been involved in 3 other major car accidents. So we get there, and the next thing you know, they're taking us down this long hallway and turn left, and you turn left and you yell, what in the, where are we? We were in a room. It was a hospital room, but it wasn't for patients. Well, it wasn't for patients that were alive. It was the morgue. And my life never was the same after that. and I was going down a bad path. I never would have. Yet, just like I believe life doesn't happen for you, to you, it happens for you, and that you can take any situation and turn it into a positive. My sister's passing passed a torch on to me to do the things that I do now. Number one, it brought me really strong to my faith, because before that, I went to church, but I didn't really have a relationship with God. It was, I believed, I didn't know. And then after that, it was like, wow, I truly am more than a believer. I know that God is out there, and I know God's in my life, and I know that God helps me whenever I need help, in good times and bad times. I know that, and I know that he never will forsake me. And so I just lived that. And then I knew, I didn't believe, I knew that I was to do something bigger with my life that was not about me, that was bigger and would transcend and would leave a legacy. And so then you fast forward, and people don't know this story, but I got invited last year to go to the University of Nebraska to work with some volleyball players. And so I went there and I ended up meeting Luke Lindenmeyer, which is Vince's son. And the way that all transpires is Luke then flies out to see me, and because he really liked what I did in Nebraska, so he flies out to see me, and I'm working with him saying, hey, how did you start following me this morning? He goes, no, why? I go, well, there's handle such and such. And he goes, oh, that's my dad. I go, what's your dad do? And he goes, oh, my dad helps veterans with nonprofits. I'm like, You got to be kidding me. Like, that's a God thing, because that's exactly what I'm looking for, but I don't know who to turn to. And I want this to be above board. I want this to be done the right way. I don't just want a foundation. I don't want just a nonprofit. I want it to be to where it's going to be, one, a living legacy, two, it makes a huge impact, and three, it's done the right way. That if anybody goes and tries to scrutinize this entity trying to make me look bad or something, or anybody that follows me, that they don't say, oh, well, this guy, Dr. Jon Porman, set this up, but he didn't do it right. No. And so who do I find? Vince. I find you. And
yeah.
I'm not saying this because you're on here. I'm saying this because the absolute truth for me is that's the reason I went through everything I've went through, so that I can now share all this information with these people to say, these are the things I did that, or my family has gone through, or, that I've had my athletes go through, or my patients or whatever, that I know what you can do to get a better life. Because just like your mindset of abundance, I have the mindset of abundance, and I don't have a million friends, nor do I want a million friends. I mean, unless they're like my 100 friends. My 100 friends are absolutely amazing people. And that's why people like you and Ricky are attracted to me, and why I'm attracted to you, because we're of the same make and same model. So in my realm, that's about frequencies. And so that's called frequencies that go together like that. That's called coherence. And so, you and I are very coherent because we have the same mission, and that is to leave the world a better place than when we came. And so,
well, you spoke about social connection, that veterans need social connection. And we've really you got a TEDx talk coming up. You got, you're going to tell your story through TEDx, potentially a book, but really with this, social connection for veterans, first responders, anyone that really is pursuing a better life for health and wellness. And certainly my goal for 2025, number one was health and wellness, and then everything else falls in after that. But we've spoken about a legendary healing community where people can come and get questions answered, have community, connect with people that are trying to raise their health and wellness, and be inspired and be empowered and achieve greater healing. What do you think about this legendary healing community that we could start together, and what that would look like?
Yeah, I think that's actually amazing, because there'll be people that can't come see me because they live in Florida and maybe they don't have the means. There's people that live in Maine. There's people that live around the world, let's say. And so for a nominal fee, maybe it's $49 a month or something like that, they can be part of the community, and they can ask questions, and they can get a hold of me. And, hey, I've got this question about this supplement, or I've got this question about this therapy, or I've got this question about this health concern that I have, or my family has a health concern, or, do you know any good retreats I can go to? Just heard of one through your group the other day. Can't remember what it's called. You can tell us if you can remember, that one of the gals is putting on for female veterans. And how appropriate is it for female veterans when they're 2 times more likely to commit suicide than the general population, and they're at a higher risk for suicide, female veterans are, than even males. So, like, it's just phenomenal that she's created that community. And so if someone asks me, or if I find a female veteran now, I'm going to say, hey, you need to get hooked up with this organization, because they've already done a female retreat, and they're going to do another one possibly at the end of this year. Or I might if I get a hold of a company and say, hey, this is somebody that I work with and that I've done some stuff with. And so I can see our community hooking up with her community and putting on a retreat together, because we put her knowledge and my knowledge together of what's worked for her group and has worked for my group over the last 30 years. It's a couple of the retreats that I've done, and, but it wasn't just female based. And so maybe there's things I can learn from her and she can learn from me. But that's the whole thing about community, right? Is that we walk arm in arm and hand in hand going through life than alone. And that's why our logo are 3 individuals holding hands at the top of a mountain, because it's not one individual going like this, like, look at me. It's all 3 of them together synergistically, climbing, crawling, walking, whatever, getting to the top together, helping each other get to the top together. And so, we talked about that. And so that's going to be a reality in the very, very near future, within the next couple of weeks, of creating this community so that people can have access to me and to my knowledge. Because I'll tell you what, man, I've been through a lot of garbage, I'll say this, a lot of dog shit in life. And I'm super glad because life happened for me. And it's like, if you look at Leo Biscaglia's quote, and that is, you got to step in a lot of dog shit in life because that's where the roses grow. And it's actually really, really true. Doesn't have to be. You could just go, oh, I got a garden full of a bunch of dog crap. And I'd look at it and go, yeah, I got a bunch of dog crap in my garden too, but I grew roses out of that. And so we all have a story, right? We all have things that are going on in our life that aren't so good, whether it be physical, emotional, nutritional, environmental, spiritual. Like, we all have these things on a day-to-day basis. And so with community, it's like this. If I'm juggling 3 balls, that's pretty easy to do, right? Because I've always got my hands on 2 and 1 suspended, but now I start doing 5 or 6 or 7 or 8. Man, I've still only got my focus on 2 and the other are suspended in the air. But what if we're juggling together those 6 or 7 balls? Well, now I have my hands on 2, you have your hands on 2. So that's 4 that are being taken care of. And there's only maybe 3 or 4 that are suspended versus there's like 6 or 7 suspended. So that's the way community works. And you know, I haven't done this. I mean, I'm the one that thought of this stuff, that wanted to do this, but I had no idea until I met you and Ricky, and then the board that I have now. I mean, I have 2 college kids that were my first 2 donors. Okay, they're Division I athletes, but they're my first 2 donors, and putting their money where their mouth is, saying, yeah, we really want to help you with this. And your son and Rebecca Alec. So Luke Lindenmeyer and Rebecca Alec were my first 2, other than myself, were my first 2 donators. I mean, that's pretty awesome. And so, you know, like, I was at a high school just 2 days ago, and I said to them, you know, kids were like starting to give up, the freshman kid, and I'm screaming, I'm going, why are you letting society tell you what your worth is? Why are you giving up? Because I know that's a mental give up. It's not a physical give up. They'd literally only been out there for like 10 minutes, and the coach wasn't killing them at that point. And then what's funny is, after I said that, they were able to do the same thing they couldn't do before. And I said, do you see how it's mental? It's not physical. But you also now have to draw upon your teammates, because it's about being a leader of one. I lead myself, but then in that word of one, O-N-E, in the O is a globe. And that's a concept I came up with. So I lead one of myself, but in that, after I lead myself, I've got to expand that and help more people, because that's awesome that I am in great shape at 61. But like, if I'm not helping other people attain that, well, then what's that really worth? Or I'm not going to leave a legacy with other people. Or, you know, I don't have PTSD, but what about the people that do have PTSD and deal with it every day? It's not just about mental willpower. It's sometimes about physiological strength and physiological reinforcement to get that to change. Now, I can really want to change and want to change and want to change, but if I still have those ruminating thoughts and I don't know some of those techniques to do, or I don't know some of those things that I can do to help me get out of that rut, I could have all the willpower in the world, but that's where community comes in and says, hey, maybe you try this, or hey, let's try that. And then that doesn't work. And then you try another thing. And then someone else chimes in. Maybe it's not even a doctor, says, oh, well, I had that, and I went to this person, and they might have something different than me. Great. Through the community, we just help that person solve a situation, whether it be physical, mental, emotional, spiritual, nutritional, environmental, whatever it is. And that's why I love community. So that's a long answer, I know, but I love it.
We see that. We see it happening for sure. And,
yes,
you know, this is a First Friday conversation every first Friday of the month. I believe August 1st will be our next one, Dr. Porman.
Yes.
The Warrior's Path to Healing, Beyond Medication, Beyond Labels. So that's a powerful title. We'll be looking forward to that. Any 30-second soundbite on the next talk, or, you know, anything that you're really excited to talk about there?
If they want to write us, they can go to info@legendaryhealing.org. They can go to legendaryhealing.org itself and check out what we have going on there. You can donate there. There's a place to donate for our veterans, first responders, and underserved youth. You know, if you know of anyone that could utilize this stuff, send them to our YouTube channel or send them to our website. Send them our information. Have them contact us. Have them come next August 1st at 12 o'clock Eastern time or 9 o'clock Pacific time, and have them watch this. Maybe it's a little bit of something that inspires them to, because I don't believe in motivation. Motivation is external. I believe in inspiring, and that is drawing from within to inspire the greatness that they have within them, to light a flame within them, that eternal flame, not the external flame that's going to give out, but the internal flame. Find out what their why is, and then help them go from there. So this isn't just about those 3 groups. It might not be an underserved youth. It might not be a first responder. It might not be military or veteran. It might be just general population person, but if they're going through some of this stuff, the thing is, we know they know some of those people. So you bring them to the webinar, you bring them to the website, you get them involved. And then next thing you know, like we build a community where we're all helping each other. And all of us know people that have been touched by PTSD, depression, anxiety, stress, like just, you name it, health conditions of some kind. And so we can all help each other. That would be awesome if people would just spread the word.
Excellent. With that, we thank you, everyone for listening, and those that are going to rewatch this. And we'll see you on August 1st. So greatly appreciate your time, Dr. P.
This is my calling. This is what I'm meant to do in this lifetime. So